Pharmacies are the vital link between medical advice and patient recovery. Here, prescriptions become real solutions, and care is delivered face-to-face. The pharmacy is where the patient's journey continues beyond the doctor's office. It's a place where commerce and clinical care meet, shaping health outcomes every day. Every prescription is a promise that must be fulfilled with accuracy and care. The pharmacy is a crucial link in the healthcare chain, ensuring patients receive the right treatment. To succeed in pharma, you must understand the unique environment and challenges of the pharmacy. This knowledge is essential for everyone, brand managers, marketers, and researchers alike. The final, crucial transaction happens here, the moment a patient receives their medicine. All research, marketing, and sales efforts lead to this single point of care. Understanding pharmacy dynamics is fundamental to understanding the business of healthcare. Patient needs, doctor loyalty, and brand strategy all converge in this space. The modern drugstore is more than a retail outlet. It's a frontline hub in healthcare. For many, the local pharmacy is the healthcare location they visit most often. It is the final node in the supply chain where clinical decisions are fulfilled. This is where the patient's journey toward better health truly begins. Pharmacies turn diagnosis and prescription into real, tangible treatment. This module will help you navigate this vital space and understand the pharmacy's central role. You'll meet key staff, learn their responsibilities, and see how merchandising, inventory, and patient counseling come together for success. This is practical knowledge, a toolkit every pharma professional needs to make a difference. The pharmacy's role has changed a lot in recent years. It's not just about giving out medicines anymore. There's much more to it. Today, pharmacies are important touchpoints for community health and wellness. They're part of our daily lives. In India, the local pharmacy is often the first place people go for help. Whether it's for a minor problem or a simple health question, people trust their pharmacy. Before visiting a clinic or hospital, many ask their neighborhood pharmacist for advice. This advisory role has made pharmacies central to primary healthcare. Pharmacists now hold a position of trust and influence in their communities. Their guidance shapes how patients behave and helps support better health outcomes. A good pharmacy experience can boost a patient's confidence and recovery. For doctors, pharmacies are essential partners in giving effective treatment. A prescription's success depends on the pharmacy's accuracy and reliability. Pharmacies must keep stock and give clear patient counseling. A well-managed pharmacy reinforces the doctor's instructions and helps patients stick to their treatment. But poor management can hurt treatment and break trust. This shows just how important the pharmacy is for both patients and doctors. For pharmaceutical companies, the pharmacy is where brand strategies are really tested. It's the commercial frontline where success or failure is decided. All the work in research, marketing, and sales comes together at the pharmacy counter. Each sale is a test of the brand's value and presence. Stockouts or substitutions can mean lost opportunities. The pharmacy team's choices directly impact which brands succeed. Pharmacies also give real-time insights into market trends. They offer unfiltered data on prescriptions and competitor activity. This information helps companies understand what's really happening in the market. In every way, the modern pharmacy is a dynamic hub at the heart of healthcare. The drugstore manager is the linchpin of pharmacy operations. They are a unique professional, balancing both clinical and business mindsets. As a custodian of public health, the manager ensures safe and ethical dispensing. As the CEO of a retail business, they drive profitability and growth. Balancing clinical integrity with commercial success is a constant challenge. A single mistake in either area can put both patient safety and business at risk. The manager's responsibilities fall into three core domains. First, clinical and regulatory stewardship. This is the foundation, rooted in their qualification as a pharmacist and their license to operate. Second, commercial and financial ownership. The manager is responsible for the pharmacy's profit and loss, their license to profit. Third, operational and team leadership, bringing together clinical and commercial goals through people and processes. their license to lead. While all these areas matter, a manager's daily focus is guided by a clear hierarchy of priorities. At the base are the non-negotiables: compliance and safety. Avoiding errors that could harm patients or trigger regulatory action is always the top priority. In the middle is the commercial engine, ensuring prescriptions can be filled. Stockouts mean lost revenue and lost customers. At the top is what sets the pharmacy apart: exceptional service, efficient operations, and developing the team. For medical representatives and pharma managers, understanding this hierarchy is essential. Managers will only focus on new products after their core needs, compliance, and product availability are met. I tell my new managers that they have to wear two hats. The pharmacist hat protects our license and the patient. The business hat protects our profitability and our staff's livelihood. The secret to success is knowing which hat to wear in any given situation, and the wisdom to know that the pharmacist hat must always sit on top. The drugstore assistant is the face and frontline ambassador of the pharmacy, shaping every customer's first and last impression. As the first point of contact, they set the tone for trust, service, and professionalism. Their influence on customer experience, patient confidence, and even sales outcomes is often underestimated. The assistant's most visible role is order fulfillment, ensuring every transaction is swift, accurate, and reassuring for the customer. They possess a strong working knowledge of medicines and inventory, quickly identifying brands, generics, and dosages to meet patient needs. This expertise is vital for speed and accuracy, especially during busy hours when reducing wait times is crucial. The assistant is also the first line of triage, addressing a wide range of customer needs, from simple purchases to health concerns. They guide customers to suitable over-the-counter products and know when to refer complex queries to the pharmacist. This requires careful training to recognize red flags and follow clear triage protocols for patient safety. For OTC sales, they ask clarifying questions and help customers find the right solutions, often suggesting helpful add-ons. The assistant also maintains the pharmacy's environment, ensuring shelves are organized, clean, and well-stocked. A tidy, well-lit pharmacy builds trust and communicates professionalism to every visitor. By monitoring shelf stock and preventing shortages, the assistant directly supports the store's reputation and performance.
We can spend millions on marketing, but the customer's final impression of our brand is created in the 90 seconds they spend with the drugstore assistant. Investing in training these frontline professionals on product knowledge, empathy, and communication yields the highest return of any investment we can make.
Merchandising is the art and science of promoting and selling products by optimizing what is offered, how it's priced, where it's placed, and how it's presented at the point of sale. In retail, it acts as the silent salesperson, shaping customer choices without a word. In pharmacies, merchandising bridges two worlds, the clinical and the commercial. Mastery means excelling in both. The first is the prescription dispensing area, where efficiency and trust are paramount. Here, fast-moving medicines are kept in clearly labeled drawers, reducing search time and projecting professionalism. Cold-chain products, like insulin, are stored in visible glass door refrigerators, signaling strict quality standards to customers. In contrast, a cluttered or disorganized dispensary quickly erodes patient confidence. The second world is the over-the-counter aisles, where customers seek solutions to everyday problems. Smart category placement helps customers find what they need and often discover related products, turning a single purchase into a complete solution. Strategic shelf placement, like putting top brands at eye level, drives sales and brand visibility. Cross-merchandising, such as placing a throat lozenge display in the cough and cold aisle, encourages impulse buys. The consumer health and personal care section focuses on lifestyle and wellness, grouping products to create strong brand presence. Block merchandising, displaying all products from a leading skincare brand together, makes the brand stand out and attracts attention. End-cap displays at the end of aisles highlight new or premium products, maximizing visibility and sales. The point-of-sale counter is the world of impulse, where last-minute add-ons can boost profits. Placing small, high-utility items near the billing area encourages quick, profitable purchases.
My team's job doesn't end when the doctor writes the prescription. The second half of the battle is fought on the pharmacy shelf. I train my reps to think like retailers. If our product is sitting on the bottom shelf behind a competitor, we've lost the war, even if we won the prescription.
Collaborative selling transforms the relationship between the drugstore manager and the pharmaceutical company. Instead of a simple transaction, both sides work together as strategic partners. The shared goal is to grow sales for a specific brand or category, creating value for both the pharmacy and the pharma company. For the pharmacy, a strong partnership means more than just stocking products. It means driving business growth and customer satisfaction. For the pharmaceutical company, the pharmacy becomes an active channel partner, not just a point of distribution. Effective collaboration is built on data-driven conversations. A skilled medical representative presents local prescription trends and demonstrates how stocking a new brand can benefit the pharmacy. Joint business planning allows the manager and the MR to set mutual goals, like launching a new product or increasing sales in a category, ensuring both sides are invested in success. Empowering the pharmacy team is key. With the manager's approval, the MR can train assistants, giving them the confidence to recommend products and support sales growth. Inventory management is the pharmacy manager's most critical financial discipline. Balancing the cost of holding stock with the risk of running out is essential for profitability. The manager constantly weighs two risks: running out of stock, which means lost sales, and overstocking, which ties up capital and increases waste. Mastery of key inventory concepts like SKUs, lead time, safety stock, and reorder points enables managers to make informed decisions. In reality, managers juggle daily pressures from multiple MRs, limited shelf space, and tight budgets, making prioritization a constant challenge. One of the most stressful tasks is managing product expiry, identifying and returning near-expiry items before they become a financial loss. True partnership is only possible when both sides understand these operational realities. The MR who supports the manager's inventory needs becomes a valued collaborator. In many cases, the pharmacy assistant is the first person a patient consults for minor ailments. This frontline role carries significant responsibility. Their most vital task is to quickly assess whether a concern is minor or signals a more serious issue that needs a pharmacist's attention. When in doubt, the assistant must always refer the patient to the pharmacist, no exceptions. Certain warning signs require immediate escalation. Symptoms in infants or the elderly, high fever, persistent cough, or requests for antibiotics without a valid prescription. To ensure safe advice, assistants use frameworks like WWHAM to guide their questions and decisions.
Is this for you or for someone else? Is it for a child? Can you describe the symptom more clearly? For example, is it a dry, hacking cough or a cough with phlegm? How many days have you had this problem? Have you tried any other medicine for this already? Are you taking any regular medicines, for example, for BP or diabetes?
For example, if a customer asks for an antacid, but also reports pain radiating to the arm, the assistant must refer them immediately. This could be a sign of a cardiac issue.
Sir, ma'am, this is a Schedule H1 drug, and as per government rules, we absolutely cannot dispense it without a doctor's prescription. Is your work very stressful? Are you getting enough sleep? Based on that, I recommend this multivitamin to support energy and immunity.
The drugstore assistant is an unsung hero in our healthcare system. Every time they refuse to dispense an antibiotic without a prescription, they protect public health. Empowering them with the right knowledge is one of the most effective ways to promote responsible self-medication across India.
As healthcare evolves, pharmacies are becoming even more central, bridging clinical care and community wellness. Digital transformation, preventative health, and accessible care are expanding the pharmacy's role in every community. The insights from this module are your foundation to adapt, grow, and lead in this changing landscape. The future blends digital convenience with the personal trust of your local pharmacy team. Build strategies that connect online and offline, creating a seamless, supportive experience for every patient. As wellness and proactive health take center stage, new opportunities for guidance and partnership emerge. This is your call to excellence, to lead with respect, insight, and vision. See the pharmacy not as the end, but as the beginning of every patient's journey to better health. Understand the people, master the processes, and build partnerships that create lasting value. By doing so, you'll drive success for your brands and make a real difference in community health. The future of pharmacy is in your hands.